Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glynn of Topeka about perforated eardrums. Thanks for being here today.
Thank you for having me.
What exactly is a perforated eardrum?
A perforated eardrum is a ruptured tympanic membrane, or basically there is a hole that has been created in the eardrum.
What are the symptoms?
Typical symptoms would be following an acute infection or some trauma to the ear. So you would expect some pain, some muffled hearing, drainage from the ear canal. Occasionally, depending on what the symptom was prior to the eardrum rupturing, you can also be still experiencing significant other systemic symptoms.
How do you treat it?
Really, when we have a ruptured tympanic membrane, most of these can be treated with topical drops. There's very good preparations of both combination antimicrobial and anti-inflammatory drops that allow us to place these through the hole in the eardrum and treat the infection. Sometimes there's enough drainage, the drainage has to be removed, and we will use a dilute solution of vinegar and water to help remove part of that drainage. We also want to make sure that we avoid water exposure during that time, especially non-chlorinated water, as that can exacerbate an infection. And then we also want to treat the pain associated with that.
And how do you know when to call your doctor?
We get that question all the time, and we actually get phone calls all the time. Most of the time after a ruptured eardrum, that can be treated by a primary care physician with those topical drops. And once those drops start taking effect, we'd like to see the patient anywhere over the next 10 to 14 days to see what has happened to the eardrum. Depending on how large of a hole will depend on what needs to happen next.
Okay, good information. Thank you for being here today.
Thank you very much.
Please join us next week for a new health topic discussion on House Calls.